Good morning. I'm Amy Lynn. Radiation. It's a scary word. And can it cause cancer? I'd really like to know myself. I'm sure you would as well. Are there risks? Here to answer all these questions, Dr. Christina Mirabeau Beale from 21st Century Oncology. Good morning.
Good morning. Thanks for having me.
Absolutely. So I really hope the answer is no. But radiation, let's talk about how it works and what are the risks.
Absolutely. So it can be a scary word, but radiation, especially in the treatment of cancer, has a history that's over 100 years long. Radiation works by essentially affecting the DNA in our individual cells. Now, cancer cells, for example, don't have the repair mechanisms to really heal themselves. So they end up dying after being exposed to radiation, and then our immune system clears them. Whereas normal healthy cells can actually repair themselves from radiation damage. And that's why when somebody's undergoing radiation treatment for cancer, for example, we do treatments that are separated once a day generally.
Now, can radiation, though, cause cancer?
It can. It's a double-edged sword. So we know that from, the history of the atomic bomb, even Chernobyl, that exposure to high-dose radiation in a very uncontrolled setting can be dangerous and cause cancer. Now, interestingly, it's the same effect of radiation damaging cells that accumulates over many, many years. So an exposure to radiation, like in those settings, causes cancer on the order of 20 to 30 years out. So when we use radiation to treat cancer, there are many important factors. So one, generally the patients come to me already having a diagnosis of a cancer that we feel is aggressive enough that it requires radiation for cure. And so it's a risk-benefit equation. We have to cure you of the cancer we know you have while also weighing the risks for long-term toxicity. That said, the actual risk of getting a cancer caused by radiation is way less than 1% over about 20 to 30 years. So it's something we really worry about when we treat children, for example, pediatric patients, even patients who are under 40, for example, because in 30 years, they're still very active, hopefully.
Sure.
But for most patients who get a cancer in middle age, for example, the actual risk of getting a cancer caused by radiation is extremely low. And the risk of their cancer coming back is generally much higher. So it tips the scale towards really safely offering them radiation therapy.
So for those of us that have yearly mammograms and for those of us that have had CAT scans, are we at risk? Having those tests, does it put us more at risk?
It's a very good question. So, as a radiation oncologist, most of the patients I'm dealing with already carry a diagnosis of cancer, but we know that several scans that are really part of how we medically manage most conditions now involve a certain amount of radiation exposure and can happen at regular intervals.
Well, Doctor, you have provided so much great information this morning. Thank you so much for coming on.
Oh, you're welcome. Thank you for having me.
Absolutely. Now, if you want to find out more about this, of course, you can log on to our website, which is fox4morningblend.com.